Welcome. We appreciate you turning into this presentation on Medicare 101. My name is Brettarmstrong. Also on the presentation with us is Corby Hansen. We're going to cover Medicare very quickly here. Let's go ahead and just get started. Corby, can you take us away?
Yeah, so what if we could save you hours and hours of research, help you prevent a Medicare mistake, and answer all your questions and make your Medicare selection process simple? Now, usually we don't use the word with simple with any government program or process, but that's what Brett and I will do today, is show you a way to make Medicare simple.
All right, so the agenda through this quick webinar here, we're going to talk about the 4 parts of Medicare, the gaps in Medicare, otherwise known as Medicare Supplement plans, option to cover those gaps, time-sensitive dates you need to be aware of when you need to enroll in Medicare, and what is the best strategy for you, and then expose the myths when it comes to Medicare. And those of you at the very end, if you keep watching this webinar to the very end, there's a special offer we have.
All right, let's talk about the 4 parts of Medicare. First of all, Part A is what covers your hospital bills. Generally, if you've stayed overnight, so it's when you're in the hospital, not a same-day surgery. Part B, medical insurance, covers your doctor's bill, either in the hospital or outside of the hospital. Part C is Medicare Advantage. These often go by acronyms like APOs. They include everything that A and B covers and often more. And then there's Part D, think D for drugs, the Medicare Prescription Drug Coverage Program. The first myth we're going to cover is selecting the right Medicare plan or changing Medicare plans is super simple. Well, as I already said, it's not very simple. The government doesn't really make anything simple other than taxes, right, Brett?
That's right.
Nah.
Let's talk about that Part A. You can see there's no premium, so you actually don't have to pay to have Part A of Medicare. However, if you use it, you can see there's a $1,556 deductible. That's per occurrence. It's not an annual deductible. We're typically used to annual deductibles, but this is a per occurrence every time you go to the hospital. If you do check into the hospital and stay overnight, however, the first 60 days are covered 100%. And skilled nursing is covered 100% for only 20 days.
All right, Part B, most people pay $170.10 per person per month for Part B. That's going to cover your doctor's costs, visits, lab work, emergency room, outpatient surgery, x-rays. It is an 80-20 plan, Medicare paying the 80% after you've satisfied the annual deductible. It's a pretty low deductible, $233, but it all depends on your income. Now, myth number 2, Medicare Part B is the same cost for everyone. Well, not everyone makes the same income, so it can vary, and Brett's going to show us what that looks like.
Here's the slide. You can see if you file your taxes jointly, husband and wife, or as a single person, you can see the ranges right here. Most people, again, like Corby mentioned, are going to pay the 170/10, but if your income's higher, and within these brackets right here, expect to pay more for your Part B premium. Now, keep in mind, the government looks back 2 years to determine your cost. So those of you who are going to Medicare in 2022, the government will look at your taxes for 2020 and charge you accordingly. In 2023, they'll look at your 2021 taxes and charge you accordingly. So be aware of that.
All right, what don't you get with Parts A and B, Original Medicare? Well, the myth number 3 is, Original Medicare covers all your prescriptions, vision, dental needs. You're just fine. Not so much. Original Medicare doesn't cover dental, vision, prescription drugs, hearing, help with long-term care, and it does not include a free gym membership. So there are plans that do, and we'll talk about those in a moment.
So when can you delay Part B of Medicare because it has that $170 a month premium? Well, if you're actively employed or if your spouse is actively employed and they have what's called credible coverage, you actually can delay enrolling into Part B of Medicare and pick it up later on once you leave that group plan. Now, with that said, what you can do and what you should do may be two completely different things. And that's where both Corby and I could help you determine, is it in your best interest to stay on that group plan or your spouse's plan, or to move to Medicare? So if you do decide to stay again on the group plan, no penalties, no loss of options. But again, what is the smartest thing to do?
All right, myth number 4, staying on group coverage is better than transitioning to Medicare. Not so much. You do have options when you turn 65, even if you have younger spouse or sometimes children still on the plan. You have the chance to go to a Medicare Advantage plan, choose a Medicare Supplement, or sometimes it is wise to stay with your employer or group health plan. Brett and I can help you know what is the smartest path, because it's not always to stay on your group. We both do Affordable Care Act coverage. If you're worried that the best, cheapest insurance is with the group, that's not always the case. So we can absolutely make sure. And if the best option is to stay on the group, we'll tell you to stay on the group and why. But in many cases, I would say the majority of the time, it's a better option to leave the group. If you have veterans benefits or TRICARE, you definitely want to have Brett and myself help you sort that out, because retiree coverage is not credible coverage if you're delaying enrollment into Medicare Part B.
Let me go ahead and just add this into what Corby just said. There are other insurance plans you can get outside of the Affordable Care Act, otherwise known as Obamacare. A few years ago, the government got rid of the individual mandate, so you're actually not going to be penalized if you don't pick up health insurance, but there are other options out there that could potentially cover you better and save you on your monthly premium over the Affordable Care, over the Affordable Care Act. And that's another option that Corby and I could help you out as well. Moving right along here, you can see if you're active military or retiree coverage or union group plan, if you simply share some information with us as far as what are the co-pays and deductibles on your current plan, what the maximum out of pocket is. Now that's not a deductible. A maximum out of pocket with insurance plans, health insurance plans, means the most that you could spend in any calendar year. So if you find out what that is, share that with us. Can I opt out? And if I do, can I go back later on? A lot of people, especially government employees, are not aware that they can actually suspend their current coverage, move to Medicare, and if they don't like it, they can go back. And we can talk to you to be on the current plan, also for your family or for your spouse. So let us know what the costs are, and does it include dental, vision, and some of the ancillary benefits a la carte. So again, at the very bottom, retiree coverage is not credible though. So if you retired and they offer you, 18 months or 2 years worth of coverage, and you take it and thinking you're going to be moving to, you could get enrollment penalties.
For some reason, you're breaking up a little bit, Brett. Hopefully they can still hear it on that end. I don't know if it's my end or yours, but let's talk Medicare supplements. Federally standardized Medigap plans are offered in all states and the District of Columbia. 10 plans offered A through N in most states. All policies offer the same benefits. So if you have a Plan G is a Plan G is a Plan G, regardless of what company offers it. The two things that differ are the price and customer service. Brett, maybe if you keep breaking up, we'll have you stop your camera, or maybe I'll do the same as well.
Okay, let's just continue on here. You can see here are the Medicare Supplement plans that Corby alluded to, A through N. And you can see the Plan G right there in the middle. That little black diamond indicates coverage at 100%. The only gap right there is that Part B deductible, if you recall from a previous slide, which is $233 annually. So if you want the best possible Medicare plan out there that covers you the best, a Plan G is going to be the plan you want to go with. And again, that is available throughout the whole country. You can take it with you.
All right, when is the supplement the best path? Well, myth number 5 is you must have a Medicare supplement, and unlike a Medicare Advantage plan, it will be your best choice forever. Not necessarily. It is the best coverage, also the most expensive. So it's got to fit your budget and your needs. But if you do want to keep your budget within a certain parameter, even with your medical costs, we can go ahead and help you do that. Travel, including second residences out of state. If you winter down in Arizona or maybe spend summers up in Island Park, then we can help you with deciding on what the best option is for you. Maybe you want to see a doctor or a specialist with no referrals. That's also applicable to supplements. Some plans have no copays, no deductibles, and you always can keep it even if your health changes, as long as you pay your premiums.
So Medicare Advantage plan, keep in mind, if you choose a Medicare Advantage plan, it replaces A and B of original Medicare. So the government pushes you off to the private insurance company. However, many of these Medicare Advantage plans do include prescription drug plans with it. It's the all-in-one plans that you see on the commercials. They're talking about the Medicare Advantage plans. Now, these plans are either PPO, preferred provider organizations, or health maintenance organizations. Over 25 plans available here in Utah. All the plans have a maximum out of pocket. It is the most popular choice when it comes to Medicare options outside of original Medicare. And they do include the dental, most of the plans include dental and vision, hearing benefits. They have also extra dollars you can use on a monthly basis to purchase healthcare products as well. And if you don't like the plan, you can change that during the annual enrollment period, which is October 15th through December 7th of every year.
I failed to mention two things. That's the plan that has the free gym memberships or Advantage plans. And you never want to be on just Medicare A and B. Parts of A and B have no out-of-pocket maximum. So in a bad health year, you could have situations where your costs to cover the gaps can be thousands to tens of thousands of dollars. So you never want to have just A and B. You want to make sure that you use an Advantage plan or a supplement or have other coverage. When is Advantage plans the best path? Well, if you would like to save some premiums, Advantage plans are the lowest premium option. You can use it as a backup for veterans or TRICARE services. Maybe you like your network of doctors. You don't want to change doctors. You want to stay within that. Brett and I know the networks very well and which plans cover which networks. So we can save you a lot of time. You don't have to look that up. We'll do that for you. Another thing is if you're on a low income subsidy for Medicare or maybe even Medicaid, Advantage plans often work well with those as well.
Let's talk about the prescription drug plan, otherwise known as just Part D. There are more than 21 plans available here in Utah. The prices for those plans, premium, depends on where you live. The least expensive plan available in the state of Utah is $6.90 a month. However, that does not necessarily mean the plan you should choose. If you let Corby and I know some information about your prescriptions, as far as the name of the prescription, the dosage, and how frequently you take it, and where you have that prescription filled at, we can let you know which plan would save you the most money on not only premium, but also on copays. It is included with some retirement plans, the Part D prescription drug plan. Late enrollment penalties may be imposed if you do not pick up a prescription drug plan when you're supposed to. People who are on VA benefits, TRICARE or CHAMPS VA, they have prescription drugs already included with those benefits, and so they can choose a plan without the Part D prescription drug plan and potentially save a little bit of money on the premium. And you can choose these plans annually during the annual enrollment period, again, just like the Medicare Advantage plans.
All right. Maybe you're worried about your budget while you're on retirement. You can apply for extra help with prescriptions if you qualify for a low income subsidy. Brett and I can help you with that. The numbers are on the screen there. You've got to have low income, like below $19,350 a year as a single, below $26,200 for couples. And then you also have to have low resources, which the government is meaning savings. You can't have $1 million in an IRA and say, we're only drawing, 15 grand a year, help us with our prescriptions. If you do qualify for that, we can help. The government will actually help with your deductibles, copays, and premiums. And these numbers, again, are all for 2022.
Let's talk about the donut hole, otherwise known as the coverage gap when it comes to Medicare. So when you and your Part D prescription drug plan spends between, or excuse me, hits $4,430 out of pocket for this year, you then enter the donut hole. And between $4,431 and $7,050, expect to pay more on the copays for your prescription drugs. Now, once you and the prescription drug company combine pay $7,050, then you leave that donut hole.
All right, let's compare and contrast. So I'll take the first side, Brett. If you're wondering, should I choose a Medicare supplement? I would let a professional like Brett or myself help you know that. But if you like the expensive, fast cars like the Mercedes, a supplement might be the right one for you because it is the best coverage and the most expensive. If you do a lot of traveling, not traveling, if you are spending time in multiple states, when I say time, I don't mean a week or two to see the kids or grandkids. I mean months at a time. Or maybe you want to be able to go to Texas to, one of the best doctors for cancer. Well, a supplement allows you to be covered anywhere in the United States, providers or hospitals who accept original Medicare. And then last but not least, a picture of a cabin there. So if you do winter in another state, sometimes even in Utah, if you're going down to southern Utah and you're used to living in northern Utah, sometimes the plans don't cover you as well, even staying within the same state. So Brett and I can show you how to figure that all out and see if a supplement's the right fit.
On the Medicare Advantage, if you're considering choosing one of these plans, again, you must have original Medicare A and B in order to have the Medicare Advantage plan. If you want to save money on premiums, there are a number of zero-cost Medicare Advantage plans here in Utah. And if you reach out to Corby or myself, we can let you know who those carriers and what those plans are. And then the extra benefits that you get with Medicare Advantage plan, the dental, the vision, the free gym membership, the extra money to purchase healthcare related products. Most Medicare Advantage plans have those extra benefits as well.
Yeah, and I should mention about 70% of my clients have Medicare Advantage plans here in Utah. So they are the more popular. That's a better fit for most Utahns.
For sure.
So let's stack it up. Medicare Supplement, you're going to plan on about 170.10 for Medicare Part B, unless you have the extra surcharges. We have Plan G, Plan Gs starting at 95.20. Brett and I are both brokers, which means we have multiple companies, dozens and dozens. We'll find the right specific fit for you as an individual. Part D can be as low as $6.90. So plan on $270 to $290 a month. You can usually keep it under $300 a month for everything in. And then all you have to do is plan on covering the Part B deductible and low prescription copays.
So when do you sign up?
Hey, Brett, you want to cover the Advantage side? I didn't give you.
I'm sorry. I apologize. Yes, on the Medicare Advantage side, you can see the Part B premium. Now that is required. You have to pay the Part B premium, and that's going to be according to your income, like we talked about at the very first. But the standard 170.10, that's what most people are going to pay. And Medicare Advantage plans start as low as $0 a month. So we add it all up, your only guaranteed out-of-pocket cost is for your Part B, $170.10 a month. It's important, however, to budget for copays at the hospital, at the doctor's office, and for prescription drug plans. But again, most Medicare Advantage plans, they have a max amount of pocket. You can see down there at the bottom, most are about $5,000, right around there. So that would be your safety net. If you have a horrendous health year, the most you would spend is that plan's max amount of pocket.
All right, when do you sign up for Medicare? Well, there's something called the initial enrollment period. If you're approaching age 65, never been on Medicare, that's you. The general enrollment period is for the folks that try to do Medicare themselves and don't get Brett or Corby to help them. That's January 1 through March 31st, and that's the oops period, and then your coverage doesn't begin until July 1. There are special enrollment period for certain life events like moves or divorces or things like that. There's a whole bunch of those. And then there's the open enrollment period that happens from, let's see, from January 1st to March 31st as well. That's a one-time do-over. Myth 6 says the plan that works best for your neighbor works best for you. So there's no reason for an agent or broker to shop dozens of options each year before recommending plans. No, we're all individuals. Sometimes we even put one person, like the husband, on a supplement and the wife on an Advantage plan. We're going to match the plan to your individual needs. We like to say that we will separate you on Medicare, but you may remain married.
Okay, as we get closer wrapping up, just a few more things. If you're collecting Social Security already, do nothing, sit back. You're going to automatically be enrolled in Medicare, and expect that card about 3 months before your 65th birth month. Okay, not your birthday. So if you have maybe an April 14th birthday, you're actually going to go on Medicare April 1st, or September 14th, you're going to go on September 1st. So expect that card to come into the mail.
All right. And if you're not collecting Social Security retirement benefits, you got to get busy. At least 100 days before your birth month, you're going to want to call Social Security. Here's their number. This is the national number. Plan on about a 30 to an hour long wait, 30-minute to hour long wait. You can also go to Medicare.gov and sign up there, or SSA.gov. That's the Social Security Administration.government website. Or you can just let us do it for you. We do this as a free service. We have numbers to our local Social Security offices. We can usually get into a live person, I would say within 3 to 7 minutes, usually save you a lot of time. We'll gladly share those. And if you'll let us, we'll help you enroll you and make sure you need to be enrolled, and make sure that you meet all the deadlines and get all your ducks in a row.
So again, the wrap up here, Medicare is hard, but we can make it simple and easy for you to understand. Myth number 7, you can only make changes during the fall of every year. Well, no, Corby in a few previous slides showed you the different time frames that you can make changes according to different plans that you have. If you're confused about that, please feel free to reach out to us. So to wrap it up, Medicare is very hard. We make it simple, and our services are free. If you reach out to Corby and I over the next little bit and let us know that you'd like to sit down and meet with us or talk to us, we'll send you this handy little navigating Medicare guide. We can email it right over to you, and you'll get that and have all the information that we just covered here during our presentation, our webinar. Here's our contact information. Now, we went through the slides very quickly, and we did that for a reason. Most people's attention span is not more than about 15 or 20 minutes. We could have easily taken an hour and covered Medicare and slowed down, but we didn't want to take too much of your time. We do appreciate you taking your time out of your day to watch this webinar. Here's our contact information. Please feel free to reach out to us. We'd be happy to speak with you.
Yeah, Brett, why don't you read it just in case someone doesn't see the visual side of this? Go ahead and read your contact.
Oh, yes. So my contact information, Brett Armstrong. My phone number is 801-787-2312. And my email address is just my name, Brett with 2 T's, Armstrong at F as in Frank, F as in Frank, I as in Indiana, G as in Gary.com. Corby's information, his phone number is 801-876-1844. And if you want to schedule an appointment with Corby, you actually can go to his name, Corby at, hyphen corridor, CORDORS.AS.ME/1ST. And you'll be able to get on his calendar and schedule an appointment.
Yeah,
thank you very much.
Yeah, you can put in www.corridors.asme/first, or you can just type that into a web browser. It'll actually take you to my calendar. You'll see what openings I have and schedule yourself literally today. So we really appreciate you showing up. We want to thank I want to thank Brett for joining this with me, and Cody and Paige, who helped us put it together. We want to thank you for taking the time to watch it. We know this isn't probably answered all your questions, and we stand ready to help you. Text us, email us. By the way, that Navigating Medicare booklet, it has all of these slides in it and more information. So if you'd like to be able to see it in your hot little hands, then feel free to reach out to us, and we will we will get that out to you and answer any questions you have. We look forward to helping you. So thanks so much for tuning in.
Yes, thank you everybody for watching our webinar. Take care.